Good morning, good afternoon, everybody. Welcome to the VUCA Africa show. My name is Gloria Mululu. I'm going to be your host today, sitting in for Saidi Brown, who was unavailable today to join us due to some technical issues. But we are happy to be here. We are very, very excited to be hosting you on this show. Um, VUCA Africa is hosted by AfNHI, and AfNHI stands for Africa Free from HIV New Infections. And this is an Africa regional advocacy network which exists to unite civil society voices and actions towards ending the AIDS epidemic by 2030. With this vision of Africa free from new HIV infections, AfNHI is committed to influencing regional policies that accelerate the ethical development of HIV prevention tools. We have been having this show for the last 3 weeks, and this is a series that we are covering to look into the different HIV prevention choices that are available. This afternoon, this morning, we shall be hosting Munashe Mhaka from Zimbabwe, who's going to be our speaker. And we shall be having a very brief conversation on the HIV prevention options. And before we start, I'd like to also commemorate this day and make an acknowledgement that today is a day of the African child. And each year on June the 16th, it is celebrated from 2003, and this day was observed since 1991, I beg your pardon. And it's an opportunity for us to focus on the challenges facing the continent's children and the youth. And so we would like to also acknowledge that today is a day of the African child. So we are going to start off with Munashe. Munashe, welcome to the show. I'd like to introduce Munashe to this panel. And Munashe is a young 23-year-old mechanical engineer student. She is super passionate about youth and women's empowerment. Currently, she is a member of AfNHI Youth Cohort and Say What organization. And these spaces, she says, they give her the platform to exercise advocacy for sexual and reproductive health rights of the adolescents and youth. Welcome to the show, Munashe.
Thank you so much, Gloria.
Thank you for being here. And so I'd like to ask this question to you, my dear. In July 2021, we had the headline saying in Zimbabwe that the Medicines Control Authority have approved the monthly dapivirine ring. And if, we'd like to hear from you, why is this dapivirine ring a game changer in the HIV prevention options for the AGYW cohort in Zimbabwe?
As you all know, young ladies and women are people who have different tastes in everything. It can be hairstyles, it can be clothing. So likewise, it is with HIV prevention methods. So the ring has been a game changer for us because now young people and young women have choices to actually decide on what they want. And also, the ring is quite discreet. It's something you can use without everyone knowing that you're taking medication. And then, so it also marks the first time that a vaginal ring has been used to show or deliver ARVs for prevention. So that's why women want it, because it's discreet and it's something you can use for yourself.
That's great to hear. I mean, we do need to acknowledge that the needs of women are different in different seasons of their lives. And, if they're not met with condoms and oral PrEP, then of course, even having, different other options available for them, then it makes it, like a variety, a buffet of options for them to choose. And so, of course, expanding these options, as you say, Munashe, is really something that we should consider as we also aim towards ending the HIV/AIDS pandemic. I see we have comments on the chat, and I'd like to read a few of them. Even with the highly effective treatment and proven prevention methods, such as PrEP, most recent data show an estimated 1.7 million people around the world still became newly infected with HIV. So, Nash, I'd also like to ask you this question. I mean, what is your message to policymakers and funders in terms of ensuring the ring is available?
Um, I guess my message to donors is that they have a responsibility to facilitate choice and to fund the ring to ensure that it's included in the range of options for women. Because you also find that another good thing about the ring is that it's a non-systematic method, because most of the women are on either family planning pills, and some take medication for their menstrual problems and things like that. So you wouldn't want something else to add on to your system already, of which the ring is something that is not does not get into your system. It's not chemical. So I think the donors should facilitate choice, because that's also another reason why other people would choose it over the existing options. So I also call on ministries of health, but I'd like to compliment Zimbabwe because, like you say, we're one of the first countries with the ministry that approved the ring. So I'm calling to other countries and other donors and other policymakers to also follow this, because we anticipate improvements in ring effectiveness based on more consistent real world use. Therefore, they should fund this.
Oh, halala. I do love your submissions, Munashe. I mean, we have had country regulators and policymakers who have engaged in this conversation since inception. And they are part of the conversation on different biomedical options that are being made available. And so, yes, I do agree with you. I mean, we need to call on other ministries of health to facilitate choice and approve the Dapivirine ring and ensure that, just as with oral PrEP, and all the other options that have been availed, that this option is definitely available. This has been such a wonderful, wonderful session. As we all know, this show is going to continue to run for another 3 more series, and we are going to be inviting you every Thursday to join us as we continue this discussion. We shall be having this show every Thursday at 2 p.m. EAT, or that's 1 p.m. SASAT. We have so far featured different speakers from different countries. We've had Shakira from Tanzania. We've had Akona from SA. And so we're really looking forward to having even more speakers who will come to the show and just give us their voice and tell us what it is that they'd want us to pass on as a message. And even as we come to a close, I know funding the ring and facilitating choice is an agenda on every HIV prevention advocate's mouth. And women needs for HIV prevention products, they vary. And we want to make sure that we send the message that the women are demanding for the ring, and women in sub-Saharan Africa demand for choice. Thank you for joining us on the show. Looking forward to seeing you next time. Thank you, Monashe, for coming and gracing our show. We do look forward to seeing you again. Goodbye.